Everyone, and welcome to the Whealthystar Parents Overview. The presentation tonight is going to be, like always, absolutely outstanding. Why? Because we have the greatest doctors to tell the story with so much passion, so much conviction, and so much help and support for parents. And the message tonight is for parents. We really want you to understand. The person that you're going to be hearing from is a Dr. Joel Nathanson, DMD, and he's titled the presentation, The Symptoms, How They Affect Your Child's Health. But before we get past step one, let's make sure that you know that you are welcome to interact. There's going to be a little Q&A box, and if you have questions, don't hesitate to just go ahead and shoot them our way. We'll kind of field them, watch them, and at the end of the presentation, because as it turns out, usually a lot of these questions are answered in process, but anything that hasn't been answered that isn't real personal or sensitive, we'll just kind of banter at the end, and Dr. Nathanson will tell you a little bit more about that specific area. I also want to tell you about the person who made all of this happen. We were just talking, in fact, before we went live about the opportunity to learn from Dr. Bergerson himself. Dr. Nathanson will tell you about that, but let me tell you that he has been around and doing this for half a century. In fact, he was the founder of Orthotane back in 1967. So we just celebrated and honored him with a 50-year dedication to his commitment and his contribution to taking care of children all over our planet. You know, he has taken care of 3.5 million plus patients in 37 countries with an appliance system that you're about to learn more of this evening. He taught at Northwestern Dental School for 25 years, and he had his own private orthodontic practice in Chicago. So yes, he is a board certified orthodontist. He's changed the world, so I call him the world changer. So you see DDS, MSD, and AVO behind that name, highly credentialed, and everything about him you will see is backed up by irrefutable data, by absolute science, by tremendous research. Well, he's been published over 80 times. He holds 80 monographs. And the biggest point that I want to share with, our number one guy is the fact that he's number two. Number two is a big deal because number one is Thomas Edison. He was the most prolific patent developer. And Dr. Bergerson comes in second with 514 current domestic and international patents. You're going to hear about the appliances because he is the world leader in orthodontic appliances, but they have no BPAs, no silicone, no latex. These are FDA cleared and they're Health Canada certified. That didn't mean much to me, but now I understand that it's the equivalent of a Class 2 medical device, something so pure in the materials that it could actually be implanted in the body like a pacemaker. So anything that's going into the mouth of your child, completely safe. It can do nothing but good. ISO certified, and of course, made in America. Now, let me focus on our very, very special guest this evening. This is Dr. Joel Nathanson, and Dr. Nathanson is a graduate of Columbia University, received his doctorate in dental medicine from the University of Pennsylvania, and after serving a tour of duty as an officer in the U.S. Army Dental Corps at St. Stewart, Georgia, Dr. Nathanson began practice in comprehensive dental care in Baltimore. And that's been going on since 1985, very entrenched in the community, a respected professional in his field. Dr. Nathanson aims to provide the best possible dental experience for his patients. His entire career has been a study in pursuing the highest and most advanced dental techniques and technologies for the benefit of his patients. That's why he's here tonight. Make no mistake about it. Dr. Nathanson is the first dentist in Maryland to receive postdoctoral training in the prestigious Lee Institute of Bioaesthetic Dentistry in San Francisco. He was also the first general dentist in Baltimore County to institute waterlays, no shot, no drill dental care in his practice. By the way, he's the first in Baltimore, Maryland, to be a Whealthystar provider. No surprise there. In 2007, Dr. Nathanson received the Mastership Award from the Academy of General Dentistry, an organization of over 35,000 dentists, and they're dedicated to improving dental care, patient care, through education. So once again, Dr. Nathanson has 1,500 hours of continuing education, and he still attends courses on a regular basis. That honor goes to less than 1% of dentists. Dr. Nathanson is a founding elite member of Dental Sleep Masters and a member of the following organizations. As you can see, American Dental Association, American Academy of Dental Sleep Medicine, Maryland Academy of General Dentistry, and World Clinical Laser Institute. How about a closer look? Are you ready? Are you ready to have a little fun? You're going to have a little fun with Dr. Nathanson, because outside of dentistry, because when I read this, I just got absolutely lit up with what goes on in his world. He has interests that include music and theater. He is classically trained singer, and he's sung the national anthem at Camden Yards. He also has acted and sung professionally. As a member of the Choral Arts Society, Dr. Nathanson has performed with jazz legend Dave Brubeck, as well as with the Baltimore Symphony Orchestra at the Meyerhoff Symphony Hall. He's sung leading roles in municipal opera company, Baltimore and Oregon Ridge Dinner Theater, and performed as a feature soloist in the Chizuk Amuno, help me out there, congregation, and in the Bach concert series at the First English Lutheran Church. For more than 20 years, he has served as a high holiday cantor at congregations from New York to Georgia. In 1987, Dr. Nathanson was a 3-time champion. Are you ready? Are you ready? You're going to see the lights go on the nationally televised game show Jeopardy! Dr. Nathanson lives in Baltimore County with his wife, Maureen, and they have 2 beautiful daughters and a son. Man, what a story, Dr. Nathanson. And as good as all that is, the best part of the story is the passion that you bring to this conversation about Whealthystar. So I'm going to just turn over the screen. Go ahead, take over, and share your perspective and what you feel. Once you know, you have to share. You have to take some action. So take it over.
Well, thank you, Kathy. I feel honored to be, the first dentist in Maryland to be doing Whealthystar. I've been treating sleep apnea in my dental practice for approximately 5 years. And one of the things that really, I always questioned about why there's so many adults that have sleep apnea. In fact, the current level of diagnosis for sleep apnea in adults, about 85% of adults who have it don't know they have it. And it's when I started treating adults, I started thinking, well, is there any way that we could keep people from getting sleep apnea in the first place? And I did some research, and I came across the information on Whealthystar, and I wanted to explore that possibility. I took the course. I was privileged to be a student of Dr. Bergerson. I took the course directly from him. And I was really amazed that this technology has been around for as long as it has, and there's so few people that really know about it. And this is a very, very widespread problem. We'll talk about a little bit more about just how widespread it is among children. As a parent,
one thing I want to definitely mention before I take myself off camera is just what a brilliant opportunity it was to be trained with the man who invented all of this. And you're right, this is such a rare thing. I also want to mention that we have another doctor who's in the wings, who is a part of our presentation from time to time, that her name is Dr. Amanda Wilson. And so there may be a little banter at some point during the evening, and anything anecdotal or interesting. Our audience needs to be prepared to be enthralled and learn a lot from everybody they hear from. So with Dr. Bergerson behind your education and you behind this story tonight, I'm turning it over and looking forward to hearing more.
Thank you. Let me talk to you as a parent. I have 3 children, as was mentioned, and it's always been my desire to make sure that my children always have the best opportunities in life. I think every parent wants that for their child. But there are things that children deal with that keep them from being the best versions of themselves. There are many children that suffer from the problems that you see posted on the slide here: ADD, ADHD, bedwetting, difficulty in school, mouth breathing and snoring, and restless sleep and such. All of these conditions, which are very often attributed to other causes, have been directly linked to what we call sleep disordered breathing, better known as sleep apnea. Sleep apnea is one type of sleep disordered breathing. So if you're a parent and your child has any of these conditions that you see listed here, chronic allergies, depression, aggressive behavior, if they're having problems in school, particularly with spelling, science, or math, these are signs that show that they should be checked to see whether they are having any kind of sleep disordered breathing problems. Over the past 20 years, all of these conditions have been linked to a common root cause, sleep disordered breathing. When your child goes to sleep, you want to make sure that they have a clear airway and they're not breathing through their mouths. If they're breathing through their mouth, that means that they can't breathe through their nose, and that's a red flag to be followed up with. So if your child does have any of those conditions that were featured on the first slide, there are options to help them, but they very often, children, particularly with ADD and ADHD, are put on drugs. There's psychiatric testing, counseling and therapy, surgery. Many times when you take the tonsils and adenoids out, that can temporarily solve a breathing problem. But the research has shown that if the surgery is not followed up by some kind of functional orthodontic therapy, that the benefits that you get from the tonsillectomy, adenoidectomy are very short-lived. Children with sleep disordered breathing can and should be tested, with sleep studies. Testing for allergies is definitely something that is indicated. But a number of times what we see is a child has sleep disordered breathing, is manifesting these conditions, and they're misdiagnosed or they're inappropriately diagnosed. The problem with any of these solutions that are on, or I should say so-called solutions on this slide, is that they really only address the symptoms. They're not doing anything about the underlying cause. The underlying cause is the fact that the child cannot breathe properly when they sleep. When any of these so-called remedies are used, they only tend to be short-term Band-Aids. They may or may not provide some benefit, but even when they do, the drugs, many have very bad side effects, and sometimes they have to take additional drugs to counteract the side effects of the original drugs, which, if they were properly diagnosed with sleep disordered breathing, they might not need those medications to begin with. And particularly in the case of surgery, a lot of times it can be costly, painful, time-consuming, and worst of all, ineffective. You don't want to put a child through something that's not going to help them, particularly when there are so many dangers and side effects that are possible with this. So our healthcare system simply doesn't have great solutions to this crisis, and it is a crisis. Dentistry can help. We have the knowledge and the tools to impact the development of a child's airway to increase oxygen intake. When a child's airway is open wide enough, they get proper oxygen, they can grow properly, they can develop properly, they will have fewer of the problems, or hopefully none of the problems that we talked about in the first slide in the presentation here. So when I got involved with dentistry, at dental school, we learned how to fix cavities, we learned how to replace teeth, we learned how to straighten teeth. Through my years as a dentist, I found that dental care is much, much more than that. Dental care is something where the mouth is the gateway to the body. And if you keep the mouth healthy, it goes a long way towards keeping the body healthy. And now, with our knowledge about how guiding the growth of the jaws and the airway and the positioning of the teeth as the child grows, not fixing it once the teeth are in there, we can improve the overall future health and well-being of every child. So look at these children. Do they look healthy to you? They don't look happy. And the pooling under their eyes, the blank stares, the fact that, you know, the boy in the slide can't get his lips together, these are all signs that things are not right with the growth and development of these children. Look at the profiles of these two children. The chins are retruded. That means they're back farther than the upper jaw. That's very often a sign that the airway is being constricted, and we'll see why in a few minutes. So what are the root causes of the epidemic of sleep disorder breathing leading to sleep deprivation in children? Well, there's greater awareness of the severe effects on children's health. A lot of research has been done recently which points to sleep disordered breathing as the culprit in a lot of the conditions that children go through that affect their health negatively. You know, we've known for years that diet is important for health. Exercise is important for health. We're rapidly becoming knowledgeable with the fact that sleep is really the third pillar of health for children as well as adults. So anything that we can do to facilitate proper breathing, proper oxygen intake for children is going to positively affect their health. Mouth breathing allows the mandible, that's the lower jaw, and the tongue to displace posteriorly, causing a reduced airway. Again, we'll see in a picture, when a child opens their mouth, it actually will constrict the airway. A child's airway is usually about 7 millimeters. If they sleep with their mouth open about 1/2 inch, it closes up that airway to only 1 millimeter. It's like trying to breathe through a coffee stirrer. I don't know anybody that can do that. Habits like finger sucking and abnormal tongue posture and swallowing. These habits cause the upper arch to constrict and to have a high palate, which decreases the room for nasal breathing. If a child has a very high palate, it constricts this whole area in here, and they won't be able to breathe properly. Now, when a child can't breathe properly, or when anybody can't breathe properly, an adult with sleep apnea, the REM sleep is reduced. REM sleep is very, very important for a number of reasons. It's important for psychological reasons, and we're also finding there's newer research that shows there are actual physical things that happen in REM sleep where it actually clears our brains from what are called beta amyloids. These are byproducts of brain functioning, which everybody creates those, by virtue of the brain functioning, and REM sleep helps to clear these out. There's research that shows that people who have Alzheimer's disease have a higher concentration of beta amyloids in their brains. REM sleep helps to clear those out. So we certainly want to be able to have our children go through proper REM sleep for proper development. It affects brain functioning, it affects the glands, endocrine functioning, and the immune system. And when a child can't sleep, it causes multiple behavioral, social, and body health symptoms. I mean, you can say that for adults as well, but with a child that's growing and developing, it's critical that they get proper sleep and proper oxygen when they sleep. So let's look at the normal facial growth of a child. You can see at 2 years old, the skull and the upper jaw and the lower jaw, they almost form a straight line. As the child develops, the growth of the face and jaws is downward and forward. And we can see at 17 years old that the full growth and development has taken place. But by then, if a child has had breathing problems, it's I'm not going to say it's too late to fix it, but why don't we fix this when they're 2 years old? Why don't we fix this when they're 4 years old so that they can have this proper growth and development? Normal growth and development of the face and jaw is forward and downward. Remember the pictures that we saw of the profile of the two girls where their jaws were very far back. That shows that they have very likely have restricted airways because there's no room for the airway to develop because the jaw is impinging on it. The lower jaw is not allowing proper growth and development of that airway. So why are so many of today's children not experiencing normal growth and development? I mean, that's a question that may have occurred to you. Population studies were recently done by Dr. Corricini, and what he came to find is that dietary consistency and toughness promote proper bone growth and proper permanent tooth eruption, bringing about ideal occlusion. It enables the jaws to come together properly. So when you have, hard foods, vegetables, carrots, things like that, it does help with developing the teeth and jaws. But when non-resistant processed food becomes ubiquitous after became ubiquitous after industrialization, and the eruption and cuspal coordination teeth lose the critical pathfinder influence of vigorous mastication pressures, malocclusion shows a rapid rise. What that means in English, instead of dentalese, is that when all you eat are soft foods, your teeth don't develop properly, they don't come into the right places, the jaws don't, the muscles that enable us to chew don't properly develop. It's like, not working out, your muscles get soft. That same thing happens in your jaw. So a soft diet of processed foods, which is everywhere in our society, provides an increase of the underdeveloped upper and lower jaws and a rapid rise in malocclusion. The teeth don't come together properly, they don't fit together properly, and they don't function properly. So Dr. Corricini's population studies showed as Western culture and soft diets were introduced in these populations, he found dramatic changes in the rate of malocclusion. First generation, it was 50%. In the second generation, it jumped to 70%. And in the third generation of eating these soft diets, 85% of the population exhibited some kind of malocclusion. So what is what problems do we see with this? Okay, the foods that are available for young children, for toddlers, what we see every day, and what we're probably feeding to our kids, they are not helping to promote the healthy growth and development of the jaws. Use of a pacifier for longer than 6 months can also have a negative effect on the proper growth and development of the jaws. An artificial nipple bottle feeding beyond 6 to 8 months can have the same effect. Another, strong argument for breastfeeding. So here we have a perfect, quote unquote, 5-year-old. Take a look at the teeth, okay? See how they're spaced? A number of times I've had patients, parents come to me with their child and they say, my children's teeth are spaced. They have, all these gaps between their teeth. Is that a problem? And I'm very happy to tell them that it's not a problem. Because think about it. The adult teeth that are going to be replacing these baby teeth are larger. So they're going to need more space. So when you see spacing between the baby teeth on a child, that's the way it's supposed to be. So this is a beautiful picture. Let's look at a normal airway. When we breathe through our mouth and we breathe through our nose, the airway is the space that's behind the soft palate and in front of the throat. And you see that it's divided into three areas here. The nasopharynx is the green area. That's the area behind the nose. The oropharynx is the upper part of the throat, which is behind the soft palate. And the laryngopharynx is the lower part of the throat. The maxilla, or the upper jaw, research at Stanford University showed that when you expand the dental arch, you can improve sleep disordered breathing in patients with upper and lower jaw constriction, and it can be valid treatment. Now think about it, okay? You've got your mouth. It's like a box. In the box, you've got your tongue, you've got your, the hard palate, the soft palate. If there's not enough room for that tongue to provide a proper airway, then expanding the arches will create a bigger box. They'll expand that area and enable the breathing, because you have a larger space for the tongue to sit, and it's not going to block the airway as readily. So here's a picture. This is a very, very important picture. On your left, you see an X-ray showing a normal airway in a child. If you look immediately behind the lower jaw, you see the space that's there in front of the spine. That's a nice open airway for a child to breathe properly. In the picture on the right, the child's mouth is open very slightly, and the lower jaw is pushed back a little bit. You see that airway is much, much smaller. Again, think about breathing through a garden hose versus breathing through a coffee stirrer. When you have less room for the air to move, you don't get as much oxygen, and the child is going to suffer from limited development, because our bodies need oxygen to develop properly. There's just no way around that. So again, normal development.
Doctor, can I ask you a quick question? This is Dr.
Yes,
Amanda.
Of course. Yes.
Hey, I know you have a lot of experience with sleep apnea in adults. Can you tell the parents out there a little bit about what type of symptoms an adult might manifest if they didn't get their sleep disorder breathing treated as a child? Like, what are some of the risks to your body as an adult?
That's a very good question. The first thing that gives us an indication that an adult has sleep apnea is snoring. If we go back to the picture of the airway, which if I can get this computer to do what I need it to do, I will be able to do that. So here we go.
I think you got it. Very good.
There we go. Modern technology. Okay.
Yeah.
So when you look at where the soft palate is, you see how close it is to the back of the throat. When the tongue moves back and the soft palate moves back and the airway gets constricted, the tissues rattle. That's what causes the snoring sound, and that's a restriction of the breathing. So if an adult is a snorer, particularly a loud snorer, about 70% of loud snorers have some degree of sleep disordered breathing or sleep apnea. The other things that sleep apnea can lead to are cardiovascular problems. It can lead to high blood pressure. It's been implicated in diabetes. It's been implicated in migraine headaches, cluster headaches, anything where you need your oxygen and your blood to be flowing freely. Even erectile dysfunction is something that's been linked to sleep apnea.
Oh, goodness. I didn't know that. That's a problem.
Yes.
Okay. Well, in any case, goodness, that sounds terrible for these parents that have this, but let alone what if you could prevent it in your kids? This is why this presentation you're giving today is so incredibly important. So I didn't mean to interrupt, but I just really want to make sure the parents understood this. Yeah.
Well, that's, again, one of the reasons I wanted to learn more about Healthy Start was because I see these problems in adults. And these are lifelong problems. These are not problems that go away. They can be treated, but it's very, very rare that somebody who has sleep disordered breathing can be cured of that condition. It's something that stays with them for life. So if we can help our children prevent it, we're doing them, one of the greatest services that we can as a parent.
So
we all
totally. But yeah, go ahead, Kathy.
I want to ask you this, because you're seeing these adults. How many of them have children that they're recognizing these issues in? And what would these adults say if there was any way they could turn back time and have the treatment for themselves that would have prevented what turned into their experience in adulthood? All this fully expressed problem that they cannot any longer address because they're adults. What do these parents say now, or how would they express themselves on that topic?
Well, when I talk to adults, and many times as their dentist, I am the first one who's discussing this problem with them, believe it or not, because we screen all of our patients for the possibility that they might have sleep disordered breathing. And so, particularly if there is an issue with obesity in the family, very often we see that obese adults have obese children. And this is something that is a problem in children as well, because when you can't sleep properly and your body doesn't function properly, even when you want to lose weight, it's harder to do that. And so, yes, of course, parents who see this in their children, and particularly if a child snores. I mean, I've had conversations with parents where I ask them if their child snores, and they say, "Oh yeah, he snores. It's so cute." And I say, "It's not cute. It's
not cute. It's dangerous. It's dangerous. And we can do something to prevent these long-term effects that these kids might have, the shortened lifespan they might have as an adult having sleep apnea. We can do something when they're young and totally diminish their chances of having lifelong effects of this. And I think it's just so fantastic you're presenting this today. So go ahead, carry on. I won't interrupt you anymore.
Thank you.
Thanks.
Okay. So we've looked at the airway. So again, looking at a child with normal facial development, and you see the young man on the right-hand side, his jaw is further back. You can tell that lower jaw is pushing against that airway, and he's not getting, as much oxygen as he needs for the proper growth and development of his body. So when you see a child that is sleeping and breathing through their mouths, please get them checked. This is something where when a child breathes through their mouth when they sleep, it's because they cannot breathe through their nose, or they've developed the habit of breathing through their mouths rather than breathing through their nose. And this is something where Whealthystar is a tremendous help, and we'll see why in just a couple of minutes. Mouth breathing while sleeping causes airway constriction, and without our help, it will not improve on its own between 2 and 12 years of age. Now, there are times when you'll discuss this with a physician, and they'll say, "Well, don't worry, the child will grow out of it." Yeah, they might grow out of it, but what happens during all those years when their breathing was restricted and they weren't getting enough oxygen and they weren't growing properly? That's not okay. That's something where as soon as we see that there's an issue, as soon as we know that there's the possibility that there could be a problem with sleep disordered breathing, that's when you do something about it. Listen to this mother describe her baby's sleep disordered breathing.
And folks, what you're watching here is you're watching a little boy who's breathing through his mouth and is having difficulty breathing. He's making a lot of noises. You can watch this video online on our website. We can send you the link later. But the mom is basically, and we're not saying for you to do this, the mom is an experienced dental provider going in and repositioning his jaw a little bit forward, which simulates the same mechanism that the Whealthystar appliance system would. And it actually alleviates his mouth breathing and guides him towards nasal breathing. And this basically just shows you how important it is to breathe through your nose and why it's important to go ahead and diagnose sleep disordered breathing and move forward with your dentist towards treatment. And come on in for a free screening if you need anything. Go ahead, doctor.
Yeah. Yeah, I'm going to play this one more time. Just listen to how noisy he is before she repositions his jaw and how quiet he is after she repositions the jaw. Hear how noisy he is. Basically, what she did was she took her child who was like the restricted airway in the x-ray that was on the right side of our screen, and she turned him into one with the open airway that was on the left side of the screen in the earlier slide. And that's what Whealthystar helps to do. So again, I talked about breathing through a garden hose versus a coffee stirrer. You know, again, the metaphor is very well taken. Okay, which one would you rather breathe through? Which one would you want your child's airway to look like? So, extended bottle feeding and pacifier use, soft diets, poor tongue position, abnormal swallowing, processed foods, all of these lead to the underdeveloped dental arches and jaws. Oral habits like thumb, finger, and lip sucking, a tongue thrust, all of these things interfere with the proper development of the dental arches and jaws, which again leads to a compromised airway. So you have mouth breathing and snoring. Many of these children can't breathe through their nose because of the restricted airway. They're swollen adenoids and tonsils, a low tongue position and tongue thrust. The tongue is very important with the development of the jaws. I've heard it said that the tongue is one of the greatest orthodontic devices that we have, because when your tongue pushes against your teeth and your jaws, it helps to guide the proper growth and development. Well, when the tongue is not properly positioned, when it's not positioned against the palate, and you get that high palatal vault, which restricts the nasal breathing, then that's something that's going to interfere with the child's proper breathing and development. Underdeveloped dental arches lead to crowded and crooked teeth. If the arches are too narrow, there's no room for the teeth. And then a large overjet, where we see that the upper teeth are much further forward than the lower teeth, what we used to, when I was growing up, call buck teeth. That's a large overjet. An open bite, where the teeth don't come together properly. A cross bite, where the teeth on the bottom are outside the ones on top. So all of these lead to a compromised airway, which in turn leads to sleep disordered breathing, restless sleep and arousals, ADD and ADHD. Again, this is something that has been very strongly linked. Many children who were diagnosed with ADD and ADHD, maybe they're just not sleeping properly. Bedwetting, chronic allergies, nightmares, daytime drowsiness, aggression, defiance, and anger, difficulty in school, particularly with spelling, science, and math. Sleep disordered breathing seems to affect the parts of the brain that help us to develop those learning skills most forcefully there. So what can a dentist possibly do about the epidemic of sleep disordered breathing in children? Fix it. When I first started treating sleep apnea in adults and started talking to physicians and patients about sleep disordered breathing, I got this question a lot. I said, they're saying, you're a dentist, what can you do? Well, when I talk to them about oral appliance therapy, and I talk to them about functional orthodontics for children, it starts to make sense. These are things where we can actually help not only treat the problem, but we can very often prevent it from occurring in the first place. And Healthy Start is a great way how we do that. As Kathy mentioned, over 3.5 million cases have been done worldwide. This is a proven, effective means of guiding the growth and development of children's jaws so that their airways develop properly, and as an additional benefit, the teeth come in straight. So many of these children end up not needing any kind of orthodontic therapy. They don't need braces. Dr. Wilson, can you attest to that as well? In what you see?
That's totally true. Yeah, and I just looked at some amazing cases last night from one of our providers who's also an orthodontist in California. And these are cases, long-term cases, even Dr. Bergeson has these, that have gone on 10, 20, 30 years past the brace, past the when the Healthy Start was discontinued, and the teeth stay straight, and they never needed braces. And on top of that, they actually never even needed a retainer, which is incredible. And we have long-term records that support this. And not to mention, who doesn't just want to wear a nighttime only appliance and not have to worry about breakage or pain or discomfort or wires poking and the food restrictions? I think it's just incredible.
Yeah, and one of the things where you mentioned where the teeth come in straight and they stay straight, when the teeth are guided into the proper positions, they don't need to be moved. And so when they develop properly in the jaws in the proper positions, there's no need for retention. I can't tell you how many times I've done Invisalign on orthodontic, what are called orthodontic relapse cases, where these people had conventional orthodontics, or some even Invisalign when they were younger or teenagers and such. They ended up with beautifully straight teeth. They wore their retainers for a month or two, and then either they lost it or they decided they weren't going to wear it anymore. And the teeth have a great memory. They want to go back where they were. And in a lot of cases, they do. So I've been treating a number of orthodontic relapse cases where people went through orthodontics when they were younger. Their teeth did go back. And so we're doing Invisalign with them. You know, they better wear their retainers this time. But with Healthy Start, guiding them into the proper places, that's not an issue at all.
That's so true. Can you imagine how much money you would save? I mean, I had braces 3 times. Thank goodness I'm in the dental field because I didn't really have to pay for the last 2. But, you know, goodness, if that was my kid that had to have braces 3 times because she lost or broke her retainers, I'd be furious. It would get very expensive. What a great insurance policy to give your child.
Yeah, my patients where they've had orthodontic relapse, they say, boy, if my parents knew, they would kill me. So again, preventing the need for that in the first place is huge. And Healthy Start can do that. And the way that it does it is by expanding the dental arches. We talked about how that enables the box to have more room so the tongue won't block the airway. It establishes nasal breathing. It discourages and in many cases eliminates mouth breathing. When the appliance is in place, it's a lot easier for a child who can breathe through their nose to kick the habit of breathing through their mouths and breathe through their nose properly, which prepares the air for optimal assimilation by the lungs. When we breathe through our nose, there are purification and moisturization and warming tissues that are in there that clean the air that we breathe. When you breathe through your mouth, you don't have those. You are breathing unfiltered air when you breathe through your mouth. It trains the tongue, that wonderful orthodontic device. It strengthens and conditions the tongue. It repositions the tongue upward so that it helps the palate to develop properly, and it promotes proper swallowing and speech habits. When they're wearing the Healthy Start appliances, they don't do things like sucking their thumb or tongue thrust, all these bad habits, and it can eliminate the open bite where the tongue it's forcing its way through the teeth and it's creating a space, and the Healthy Start appliance helps to prevent that from happening. It advances the lower jaw to correct that overjet, to that buck tooth syndrome I talked about before. That in turn increases the airway. Remember, when the lower jaw comes forward, it opens the airway. And it can correct most of the symptoms caused by sleep deprivation by opening that airway and enabling the child to breathe properly. Since they get proper oxygen, it encourages proper facial and body growth. And it corrects most orthodontic diagnosis to what is called a class 1. That is I guess you would call that the most desirable configuration of the teeth, the relation of the upper to lower jaws. It provides an ideal overbite and overjet. The teeth mesh properly. That's what proper intercuspation means. All 28 teeth are in place before the age of 12. The 12-year molars are the teeth that make up 28. It reduces or eliminates future relapse. Again, when the teeth come in properly into the proper places and they are secured in those places by the ligaments and the bone that develops as these teeth come in, you don't need to move the teeth, and so they won't move back to where they were because they're already in the correct position. And so it greatly reduces the chances for the need for orthodontic treatment later on. So here's a case, a young man, age 9. He's a cute guy, but you see he's got that retruded lower jaw where it's, too far back, and you can be sure that that's impinging on his airway. After the treatment of Whealthystar, 5 years of Whealthystar treatment, look at that profile. He could be a movie star, that kid. His jaws have developed properly, and he looks much healthier. Again, here's a picture of the airway. Look at how constricted it is when his jaw, you can see his lower jaw is actually, physically impinging on his airway there. That is restricting his ability to breathe. When you bring the lower jaw forward, it opens that airway, as it's shown in the after picture there. And look at what his teeth did with no brackets or wires. Had that big space in between. He doesn't have that space. And he's not going to have to worry about wearing a retainer. So here he is. I think we'd all like to have a smile like that. I know I would.
Hey, I have that already. No, I'm kidding. But that's the benefit of being an orthodontist. But in any case, just to let you know, and all the parents out there know, my kids are Whealthystar patients. They're 8 and 11. They're a little behind on their dental age, so I maybe started them a little bit later age, a little behind on their skeletal age. But it's been no problem introducing at home. There's been no drama, no tears. It's not there's no discomfort. They actually love wearing it. And my son, who's 11, almost 12, he says, "Mom, I already see my teeth getting straight, and I see kids in my class, he's in 6th grade, that have the metal braces, and they're so miserable at lunchtime. And I'm just so thankful that you work with Whealthystar. And I am one of the first kids in my class to ever have it. But once you have one kid that has Whealthystar, all the other parents hear about it because it's noticeable, the changes and even the behavioral changes. And they are going to tell their friends. They're going to share it on social media. They're going to hashtag it. And you're going to have a lot of patients in your office.
Well, I certainly would love that because I want to help as many people as possible with this. And, this is, it seems so simple. It's such a simple idea. And it just works so well when, when you prevent the teeth from going into the improper place, when you prevent the tongue from going into the improper place and causing the jaws to not develop properly. Why would you want to do it any other way when you could do it like this? Look at the results we get just for a year on Whealthystar with this patient here. These teeth were, you can see on the lower jaw particularly where there was potential crowding and, they could have come in crooked. But look at how nice and straight those are. And look at the, on the top there, how those teeth were guided into their proper places there.
That is incredible. I love it. Oh, I'm excited. You're going to talk about ADD. That's really important. I'm looking forward to listening to this.
Absolutely. Sleep disordered breathing and ADD, ADHD have been very, very strongly linked in the research for years. Dr. Karen Bonnock did a 6-year study published in the journal Pediatrics, where she looked at over 11,000 children looking at sleep disordered breathing and ADD, ADHD. And a key result of her study was that sleep disordered breathing increases the risk of ADD, ADHD by at least 50%. Think about that, at least 50%. I also heard about a study where there were children that were diagnosed with both sleep disorder, with either sleep disordered breathing or ADD, ADHD, and it was very difficult to tell the difference between the two groups. So if your child's been diagnosed with ADD, ADHD, and you haven't examined the possibility that they could be having sleep disordered breathing, that's something that you really should look at, particularly before putting them on medication. It's very, very important to look at all angles and explore all possibilities before choosing that course of treatment. Sleep disordered breathing and bedwetting. When your reduced oxygen probably interferes with deep REM sleep. We talked about REM sleep, and it affects the neurological and hormonal symptoms, which probably interferes with bladder control. I remember when I took the course with Dr. Bergeson, he talked about a young woman who was wetting the bed at 18 years old, and she was mortified. She would never do a sleepover as a teenager. She was always afraid to go and spend the night at a friend's house because she was afraid that she would wet the bed. She started the adult or the older Whealthystar appliances, and practically overnight the bed wetting problem went away. She just wasn't breathing properly when she slept. And sometimes that's the answer. Sometimes it can be as simple as opening the airway. So here are some case studies showing what Whealthystar can do. Here's a young lady, 2 years of Whealthystar. Again, we looked at, we talked about what we call overjet, where the upper teeth are so far ahead of the lower teeth. Over 2 years, her lower jaw, I'm pointing at the screen. I know you can't see me pointing at the screen here, but her lower jaw was catching up with her upper jaw at 7 years old. And then at 12, you can see she has the proper bite and the proper overjet there. The upper teeth and the lower teeth are lining up beautifully, and they're beautifully straight. Here's a young man going from 12 years old to 14 years old. Again, the overjet was very large in this particular case, and the Whealthystar appliance enabled that lower jaw to catch up to the upper jaw. Here's a young man who went through, well, he went through 6 years of Whealthystar, but just look at the difference between age 8 and age 9 in the oral pictures over here. The upper teeth came together properly, and the lower teeth went a long way towards catching up with those upper teeth. So Whealthystar changes lives. I got into it for the reasons to treat the sleep disordered breathing, but the added benefit, the added orthodontic benefit is something that is really wonderful for children. As I said at the beginning of the talk, I always want every child to have a chance to become the best version of themselves. And the way that happens is by us giving them every advantage that we possibly can as parents. So I actually brought out, here's one of the appliances here. There's a young boy who's kind of spitting it out. And it's very soft. It's very comfortable. You might be able to see there are little garages in there for the teeth to erupt into. That's how it helps to position the teeth as they grow into place. So, you know, given a choice of having something like this, which a child wears at night and for, you know, a few hours during the day versus having braces, you know, I know which one I would choose given that choice. And knowing that we are helping them to breathe properly and to grow properly and to avoid the problems that sleep disordered breathing can cause in children, you know, there's no reason to not consider this, particularly if your child is a mouth breather when they sleep. You know, if you don't know, if you're not sure, go in and watch your child when they sleep. You know, just spend a few minutes watching them, you know, a couple of nights. And if they only breathe through their mouths or they predominantly breathe through their mouths, particularly if they don't have a cold or something like that, then that's a red flag. That's something that needs to be checked out, because nasal breathing, we were meant to breathe through our noses. We are designed so that nasal breathing filters the air and gives us the best oxygen distribution that, you know, that our bodies need. When a child is breathing through their mouths, not only is that air not being filtered, but you saw how it restricts the airway. 1/2 inch of opening will close the airway to about 1 millimeter in diameter, and that's not enough to breathe through. So if your child is mouth breathing, if they're restless sleeping, if they, you know, have night sweats, nightmares, anything like that, these are all red flags. These are all reasons to follow up. And it's just a simple questionnaire. When we have parents that are interested in investigating this for their children, it's a questionnaire that they fill out. And again, they need to watch their children while they're sleeping in order to fill this out. I've had parents, you know, try to do it from memory, and you know, I tell them, no, you need to take this home, watch your child, fill out this form, because they filled it out one way in our reception area. They take the form home and it's completely different when they've actually watched their child. And so that's how this form is meant to be used. So it's a simple matter of answering those questions, watching your child, you know, seeing whether they have any of those conditions that were on the first slide, you know, particularly if they've been diagnosed with ADD, ADHD, if they're wetting the bed, they're aggressive or having problems in school. Please follow up with Whealthystar, follow up with an investigation to see whether it's just the fact that they're not breathing properly when they sleep. That could be, you know, all that it is. And, you know, if we can do one of these for them and help them with that problem, then you have set them on a course for a much, much better life. And what parent wouldn't want that for their child? One of the things that I mentioned to Kathy before we came on was I had a mentor who once told me that once you are in possession of knowledge that can help people, you have an obligation to use that knowledge. So now that you have the knowledge, please use it to help your children.
Dr. Nathanson, you have a slide up there that shows your location, because I really want people to know you're the only one that is there in the area, and how you handle a family that brings a child and what kind of evaluation you would do with them.
Okay, well, thank you for asking that. This is our information. We're located in Hunt Valley, Maryland. It's north of Baltimore. For those of you in the Baltimore area, it's right outside the Hunt Valley Town Center. When even children that don't come in, who come in just for a dental checkup, I always ask the parents about, you know, sleep disordered breathing, or are they mouth breathers when they sleep. But any parent that recognizes the signs and symptoms or the conditions in their child, they just need to give us a call. We'll bring them in. I do a quick examination of the child. You know, one of the things we want to look at are, you know, do they have large tonsils? Is that something that could be impinging on their airway? Can they breathe through their nose? These are all things that we take a look at when we do a Healthy Start evaluation for a child. We have the parent take home the questionnaire and fill it out, and then we do a consultation, and based on the answers in the questionnaire and the consultation examination that we do, we discuss whether a Healthy Start would be something that would benefit the child.
Dr. Nathanson, I'm going to ask a question of you and Dr. Wilson, because you both have such a great expertise. I listened to what you have done in the area of sleep. You're in the top 1% among thousands and thousands of dentists as you've been recognized in your profession. And Dr. Amanda Wilson is an orthodontist, so she has a number of years of additional training and looks at the mechanics of growth and movement. And you're focused on the airway and what's going on. But where does one begin and one end? They're completely connected. So my question, maybe we'll have a slightly different answer. I don't know. Obviously, you've already said nobody chooses braces if they could do this. It's simple. The hygiene is there. It's easy. It's brilliant. And it's so simple. There's such logic to it. But here's my question, because I'm looking at it like the parent, like the grandparent, and knowing what sometimes they're given as a response when they talk to their dentist or orthodontist who may not be aware, who says, yeah, I've heard, yeah, well, here's something else you might look at. So how does the parent have the wherewithal to recognize what they've got in their hands with the story you've told tonight between everybody on this conversation? How do you compare this to anything else out there that a parent might hear about to consider along with their evaluation of Healthy Start? Both of you jump in here and help a parent understand how it all measures out.
Go ahead, Doctor. You go first.
To me, Healthy Start is just a simple and elegant kind of treatment where, and it's completely reversible. You're not putting brackets or wires on teeth or anything like that. My feeling is that there's no reason to not try it, particularly when this can be the answer, when this can be the preventive means of giving this child, a beautiful, not just a beautiful smile, but, being able to breathe properly. There's no reason to not try it, if a parent is hesitant, I would ask them, what's holding you back? What is it that you don't understand about your child not being able to breathe when they sleep, and why that's a problem? Because I'd really want to know the answer to that, because if there is some kind of misinformation that they have, I want to be able to set them straight, and I want to be able to benefit the child, because if they don't get some kind of help, this is not something that gets better on its own. This is not something that goes away. And if they develop into a sleep apneic adult, that's something that they're going to be living with for the rest of their lives.
That's awesome. And oh no, go ahead, Kathy.
No, I was just going to say, not on our watch. We know, yeah. Once you know it, you can't unknow it. So it's kind of like you were talking about, once you know something, you're obligated to do something with it. We can't stop ourselves. I mean, there are a lot of things I won't have a conversation on, but try and stop me from telling this story, because there's a child who needs the adult to find that way of getting this message through so that they don't grow up with that. So Amanda, what is your thought on anything that a parent would?
And I'm just going to kind of add to that, just from being an orthodontist. I'll be honest with you, I didn't learn about Healthy Start in my residency. Granted, I graduated almost a decade and a half ago, but orthotane was around then. There wasn't something that we were taught, but some pediatric residencies and some orthodontic residencies are teaching that. So it really just depends on where your pediatric dentist, where your general dentist, where your orthodontist went to school, whether or not they know that, or whether they've taken the right amount of continuing education courses to learn and develop. They may just have no idea. So if you go and talk to your dentist and they say, oh, what, huh, no, say, hey, we can give you some additional information. You can connect with us at 844-HEALTHY-START, 844-KID-HEALTHY, or thehealthystart.com, and we can even contact the dentist on your behalf. We will reach out to your dentist and give them additional information on the system so they can be more educated and make an educated decision to help you or your patient, your child, to be, you know, a healthier child. But ultimately, we have a great provider portal, so you can jump on and you can find a provider in your area. There's lots of providers out there. They're amazing. And I don't know if all the parents know this, but there has been 3.5 million cases treated from our family and series of appliances, Whealthystar, Orthotame, in the last 50 years. So that's an amazing amount of patients that have been treated. So there's long-term healthy research that supports the use of this system.
Okay.
I wouldn't use it if it were otherwise. You know, I always vet things very, very carefully, and you know, to go to the question of you know, why don't people know about this? Why don't doctors, you know, physicians and dentists know more about this? I didn't know about it until I became involved with sleep, and I came at this through sleep. And to me, that's my main reason for doing it. But I love the idea of helping children to develop properly so that, you know, they can have a lifelong, healthy, beautiful smile that they don't need to have retention for. To me, that's an added benefit. But I have had some parents express interest in Whealthystart, you know, strictly for the orthodontic benefits, which is, you know, yeah. That's a wonderful reason to do it as well. You know, if a child isn't having the sleep disordered breathing problems, there's no reason for them to not do Whealthystart to help guide their teeth into proper place so that they can, you know, possibly avoid, you know, conventional orthodontic therapy later on.
Yeah, just to add to that, you know, the one thing, we all have very similar stories in one way or another. The thing that drew me to Whealthystart is I started doing research and talking to other doctors about a solution that prevent my patients from having to get jaw surgery. So a lot of parents can't afford 2 phases of ortho. Phase 1 and phase 2 can be $10,000 to prevent the need for jaw surgery. It's too expensive. So parents are waiting. They're waiting too long. And then they're finding out, yikes, there's nothing I can do. My kid has to get jaw surgery for a good result. Oh no, you know, that's $80,000. And I don't know about you, but I don't have that in my bank right now. So that's not an option for me or my kids. You know, for most Americans, that's not an option. That's too expensive. Jaw surgery is painful. Jaw surgery is risky and jaw surgery is dangerous. I'm not saying that you shouldn't have it if you need it, but the vast majority of orthodontic surgery patients treatments can be reduced or eliminated if you do early intervention. And that's what we're here for.
And I know that with Dr. Nathanson's 1,500 hours of continuing education, that a lot of the parents that are perhaps listening tonight who don't have a doctor that they know of that's going to be a provider, we do have online education that is just being kicked off. And so it's a wonderful opportunity. And that is the way most of the doctors and their staff do learn about Whealthystart, because the base curriculum just doesn't cover everything. And so this is what you find in the real world. And you also hit on something really important, both of you, and that's the cost. And we don't generally talk so much about that, but when you compare the cost of doing something, you know, kind of preventatively versus the cost of anything down the road, Band-Aids and, you know, second rate to at best, the cost, what do parents need to understand about the financial side of this?
Well, Whealthystart, you know, again, I am not as familiar with what orthodontists charge for a full orthodontic case, but the few conversations that I've had with parents, what we charge for Whealthystart is much, much less than a full orthodontic case.
Much more for much less. And so on that note, I say that we have delivered a very compelling conversation and an opportunity for parents to take a very good step forward. So if it's all right with everybody, I'm going to say, Dr. Nathanson, so great to have you with us.
Thank you for having me.
Share your expertise and to, I know, be reaching out to a lot of the people that are your patients and in your community to hear this story for the first time. I always love it when we have the added conversation from somebody who has a slightly different role in the dental world as an orthodontist. So Dr. Amanda Wilson, thank you for being
sure.
And, you know, kind of
thank you, Dr. Wilson. Appreciate it.
It was a pleasure.
And Susie Lafredo, who is behind the scenes, who is pulling all the strings, making us get on board, get online, and get on with it now. So I'm going to say for Healthy Start, I'm Kathy Turner, and we're happy that you were with us, and we'd like to see you come through the door. If you don't walk in with a smile, I guarantee you're going to walk out with one, because we do have the comprehensive solution at Healthy Start. We fix it. So thanks for being with us tonight, and everybody have a great night. Good night now.
Good night.
Good night.